Welcome to the Dose of Optimism, where I talk to the optimists in healthcare. My name is Omkar Kulkarni, and I work at one of the world's best children's hospitals, where I lead innovation. I started KidsX, which is a premier international startup accelerator for pediatric innovation, and over the years, I've met thousands of startups, investors, and innovators. Every one of them has a story, and every one of them is optimistic about the problems they're solving. On this podcast, you'll meet amazing people who will share their stories and what makes them optimistic about the future of healthcare. A little note before you get into this episode. This podcast is for informational purposes only. We are not offering medical advice, and we're not endorsing any products. Please talk to your own physician about your health or the health of your children. All right, let's get started. Our first guest is Sam Polk, CEO and founder of Everytable, a social enterprise company that delivers fresh, made-from-scratch meals priced by neighborhood income to make healthy food accessible to all.
We developed a nonprofit that is now called Feast. It was called Grocery Ships at the time, that works with families in low-income areas to help them get themselves and their kids healthy. And it was through that process where we came to know tons of families in South Los Angeles, and it basically became clear that there was huge demand for good, healthy food. The problem was getting it to the right price point. And so that sort of forced me to start looking at how food businesses are structured and why does a salad at a fast casual restaurant cost $17 when burgers and fries and chicken nuggets can cost as low as $6. And we basically came to understand that it's all how the back end supply chain of those businesses are structured. And so Everytable is the response to that. And it's a very simple structure where we have a single central kitchen. So to give you a sense of scope, we have about 40 stores throughout the state of California. And all of those are serviced by a single kitchen. And that kitchen is a scratch cooking operation. Everything is made from scratch, just like the highest end chefs do it. But we also run it like a manufacturing plant insofar as there is extreme efficiency and automation and focus. And every day we make tens and 20s and 30s of thousands of meals per day, and then package those into grab and go containers. And then we put them on our fleet of refrigerated vehicles that takes them to our stores. Because the stores don't have a kitchen, which is the most costly part of building a restaurant, they're significantly less capital intensive to build, but they're also significantly less operationally intensive to operate because you only need a single person because all of the cooking has been done in the kitchen. And so if you walk into an Everytable store today, you'll likely see a 800 square foot space that costs about $300,000 to build with a single person operating it. And the efficiency of the kitchen and the operational efficiency of the stores enables us to get fresh, high quality, sourced from local ingredients, incredibly good meals to people at really below fast food prices at this point.
What does it cost to get a meal in Everytable these days?
Yeah, you can get a full meal, and some of our best-selling meals are like a pollo asado, which is this incredible pollo asado with seasoned rice and vegetables, and that you can buy for in the neighborhood of $6 or $7 in stores in underserved neighborhoods. And then you also have stores in more middle-income and affluent neighborhoods like Santa Monica or West Hollywood, and there you can buy that same meal for $8 or $9.
So the prices are different based on the geography. How does that work?
So we basically wanted to create a system that worked for everyone insofar as meals were affordable. And it's pretty simple when you look at per capita income in South LA and per capita income in Santa Monica. They're just in different ballparks. And so we figured that we would make the prices reflect that while at the same time ensuring that the stores in underserved neighborhoods were profitable. And the way that works is a couple ways. Like, people often think there's less demand for healthy food in underserved neighborhoods, but our experience is the opposite. And the good news for us and the bad news for the world is that there's no competition and there's significantly lower rent in neighborhoods like that. So we find stores in South LA and Watts and Compton are often more profitable than stores in West Hollywood and Santa Monica.
So let's talk about schools. You're getting involved with school meals. I've been really interested in this space. So how does that model work? Is it the same thing, central kitchen, perhaps different standards? What kind of food do you serve to kids?
It is wild to learn about the school food market. We have to design specific meals for schools that follow the NSLP, National School Lunch Program, nutritional requirements. And those are actually pretty clear and easy. And the size of our kids' meals and all kids' meals or all school meals is roughly half of the size of our regular meals. So our regular meals will be 16 ounces and these will be about 8 ounces. But we use the exact same ingredients. So there's no difference between the ingredients that go into each of those meals. What is different is obviously a smaller portion size. And then if you have kids, they're probably the hardest consumer to meet their sort of need state. And what they want often is simple and flavorful, but not complicated, not sophisticated, etc. So we have meals that reflect that. We're excited that our first partner is the Compton Unified School District. And by the way, the work that we do in the city of Compton, I think, can show a little bit about the potential scope of the impact of Everytable. So in Compton, which often might be considered a food desert, you have an Everytable store that has been selling to consumers for going on 7 years now. We are the only food provider on campus.
Sorry, Sam, the store is on campus somewhere?
One store is in the Compton city proper. We have another store that is on campus at Compton College and is the only provision of food on campus. And also, they have this really incredible principal who basically figured out how to have budget for every student to be able to eat. We also now have the contract with the Compton Unified School District to feed all 31 elementary, middle school, and high schools in the city of Compton. And we have the contract with Compton City for the Meals on Wheels food insecure senior contract.
So for the 31 schools, is that through their normal school lunch program?
Compton does, which is really interesting, is that Compton actually prepares food on site. So at all of those 31 schools, they have staff and they cook meals. They bring in Everytable meals to augment that for about a third of the meals that are served. And there's a couple of reasons they do that. One is that labor is often a real struggle at school cafeterias. For example, a lot of people don't show up on a Friday. So in those days, they can supplement with Everytable meals. But also, and this is I think the really interesting part is they really believe Compton in scratch cooked, high quality food for their kids. And the way that most school food works is even when you have sort of so-called scratch cooked kitchens or kitchens at a cafeteria, most often what that is, those organizations buying frozen pre-processed stuff and then heating it up. And that's no insult to them in any way because frankly, that's really all that's on offer to them. But there's a lot of belief in these cafeterias and desire to create even better food for the kids. And so Everytable is a great solution for Compton.
That's great. I think the idea of innovating with school lunches is great because not only are you helping kids now, making sure they're nourished, and that obviously has an impact on their education, all those things, but you're setting them up to be healthy eaters as adults, which is super crucial for the future.
I think it's simply like when you think about food and both as a consumer and as a business person, there's this basically constellation of variables that you're solving for, which is first of all, you want it to taste really good. You want it to be extremely high quality, but you also want it to be incredibly affordable and incredibly convenient. And I say that because we are huge fans of scratch cooking and most of our customers in Compton, in Watts, in West Hollywood also love cooking and do that as well. And that's the holy grail, right? The more home cooked meals you can have versus stuff that you buy from a 7-Eleven or a McDonald's, the better off you're going to be. It's just that in the modern world with two-income households, not everybody can cook all the time. And so the beauty of Everytable and the beauty of how it can reshape the food system is that what has become so easy for people and convenient and affordable is this processed junk. But now with systems like Everytable, you can have food that is of the same quality ingredients, maybe even better than you have at home, scratch cooked in the same style that you would at home, but now you can buy it for $7, for $6, and your kids can either have it served to them at school or for $4 or $5 at an Everytable store.
Sam, thank you for joining us and sharing all that you're doing.
And now a thank you to our generous sponsors.
All right, we want to thank our sponsors for A Dose of Optimism. Our first sponsor is Nabla. Nabla. This will help keep us practicing longer. For 85,000 clinicians and counting, Nabla is the key to better balance. With real-time notes and dictation in one platform, clinicians are saving hours on documentation time and strengthening patient satisfaction. Learn more on nabla.com. And to Mercury Bank, online business banking for startups and small businesses. Go to Mercury Bank for powerful banking, simplified finances. And finally, we want to thank our presenting sponsor, KidsX. KidsX is a global ecosystem of pediatric innovators anchored by a consortium of the leading children's hospitals motivated to accelerate health innovation and transform care in pediatrics. Our second guest is Patti Miller, who leads Too Small to Fail, the Clinton Foundation's flagship early childhood initiative, driving a national campaign that equips parents with simple tools, talking, reading, and singing, to boost infants' brain and language development from day one. A former vice president of public policy at Sesame Workshop and Children Now, Patti brings a wealth of advocacy experience in shaping children's media and early learning policy to her role at the Clinton Foundation.
I'm Patti Miller, the CEO of Too Small to Fail, the early education initiative at the Clinton Foundation. And we really like to think about ourselves as a public awareness and action campaign focused on providing parents and caregivers with tools so they can talk, read, and sing with their young children starting at birth. When we started this initiative, because we know how critical those early years are for young children's early brain and language development. And the research says the best thing that a parent can do is to engage with their child from the moment that they're born. So we really try and make it as easy as possible for parents to engage with their young children during everyday moments and routines.
So read, sing, and play with your children, right? Sounds easy enough, but why is it so hard?
I think for a number of reasons. One, parents have so much on their plates, right? Parents are really busy raising kids, working one, if not more jobs, right? And so a lot of times something like talking, reading, and singing can get not as prioritized because of just the day to day things that families have on their plates and things they have to do. What we try and do is make it as easy as possible. The main goal of our campaign is to meet families where they are, is not to ask them to do yet one more thing, but to think about the 24/7 of their days and go to meet them there. So when we started Too Small to Fail, we thought, let's not ask parents to sign up for a webinar or come to a class. Let's find them in the places that they already go: the laundromat, the grocery store, the playground, the pediatric clinic, the social services agency waiting room. We really try and think about the various places and spaces that families go, and we go and we meet families there. And so it's like when you have some time to wait while you're waiting for your laundry to dry, right?
I've heard about this laundromat project that you've had.
So when we launched Too Small to Fail, we started thinking about where parents go. And what we learned was that families spend about 2 to 2.5 hours every week at the laundromat. And there's a lot of what we call idle time where they're waiting. And we thought, oh my gosh, what if the laundromat was a great opportunity for early literacy engagement? So we partnered with the Coin Laundry Association, which is 5,000 laundromat owners across the country. And at first we said to them, what if we put posters throughout laundromats across the country, encouraging parents to talk, read, and sing? And what if we had tip sheets available to them? We did that, which was great. They host free laundry days in under-resourced communities across the country. And we said, well, what if we added early literacy to your free laundry days? So families come in and get to do their laundry for free. And we have librarians and other early childhood folks engaging in children early literacy activities. Kids get books to take home. And we started doing that. And now the Coin Laundry Association, they do these in communities across the country, these free laundry and literacy days, which has been remarkable. And then we said, well, what happens if we transform the laundromat as opposed to just like this one day where families can come. What if we transform the laundromat into a really fun, engaging early literacy space in a corner of the laundromat? And so we piloted a project in New York City in 3 laundromats. NYU did an evaluation, and we literally added like a comfortable couch for parents and kids to sit together, a whole library of books and blocks and other educational toys, and made it very playful, colorful, and learning rich with prompts and posters and alphabet rug. And what we found was that kids were engaging in 30 times more literacy activities in laundromats that had these family read, play, and learn spaces compared to other laundromats. And we've been scaling this across the country too.
Are you finding that providing the information and the awareness to parents is enough, or do you have to teach them specific things as it relates to this work?
For some parents, just providing the information and tools is enough. And so for other parents, they may not be as familiar with the research. And so we try and share that information too. Last week I was in California and we were transforming a social service agency waiting room and using a similar model to what we do in laundromats. And as we were setting it up, it was really great to see like all these young children started coming into the space halfway through it being created because they're in this waiting room for a couple hours, right? And it was like this really fun, engaging space. And so as we're putting it together, the kids are coming in, and there was a little boy waiting with his mom, and he looked like he wanted to come over, but was a little shy. So I went over to the mom and I said, "Hey, does your son want to come over and engage? We're not done yet, but there's enough set up." And she said, "He's only 2. He's a little too young for that." And what I said was, "Well, actually, it's never too early to start, right?" For some parents, it's good information to learn. And that's why what I love about the American Academy of Pediatrics is that when they put out that early literacy policy statement, really trying to get the word out to families that talking, reading, singing, read with your children starting at birth. Like that's how the brain is built, is that serve and return, that back and forth connection between parents and caregivers and their young children.
I saw it's somewhere in Europe or Asia where they redesigned bus stops where people are waiting as well to have some version of engagement interaction with families.
Bus shelters are a really great opportunity, and we have done the same. We have also put messages on the buses themselves. Tulsa was the first city we did that. In 65 buses across Tulsa, there were messages for parents. And literally, it was like, let's talk about the bus and what do you see outside the bus and how many wheels do you see? And a lot of just really great, engaging prompts for families. Transit is really a terrific opportunity. We also had messages and prompts on the subway systems in New York City, because that is also a great example of where you're sitting and waiting. You might be moving, but you're waiting, right? So it's another great opportunity.
As you look forward, what are you most excited about?
I love the idea of the social service agency. And we have been partnering with the state of California and the Department of Social Services. We transformed 3 county waiting rooms, got some really a positive evaluation findings, and now we're transforming 3 more. And the goal is to try and scale across the state. Really excited about that. Another really good opportunity is to engage parents through media. And we've done a couple different projects. One, we actually worked with Hollywood and integrated messaging about the importance of talking, reading, and singing in the scripts of popular television shows. So we had about 15 different shows do it, from Orange is the New Black to Law and Order Special Victims Unit. And that's another opportunity to meet parents where they are, right? We all have our favorite shows, and then there's messaging that becomes kind of organic to the storyline. We also had a really wonderful partnership with Univision to reach Spanish-speaking parents. It was an 8-year campaign we did, and it was PSAs and content in news programming, but it was also integrating content into their popular entertainment and reality shows. And then we even co-created a 2-part telenovela, and the first part of it took place in a pediatric clinic. So there's a lot of really unique ways to think about the role of media. We even did something with Spotify where we had playlists curated by celebrities for different times of day, so playtime, commute time, bath time. And so there'd be fun songs, and then these celebrities would encourage parent-child engagement in between the songs and different activities they could try. So I just think really trying to embrace and harness the power of the media that parents and caregivers are engaged with to get really important messages to them is a great strategy.
Well, Patty, thank you so much for the work that you're doing, and thank you for joining our podcast. We appreciate your time.
Thank you so much for having me.
Our final guest is Dr. Laura Wood, Executive Vice President of Patient Care Operations and System Chief Nursing Officer at Boston Children's. She's previously held senior nursing leadership roles at Johns Hopkins, CHOP, and UPenn. Laura believes that nurse-led innovation is crucial, and today she will tell us about some nurse-led innovation happening at Boston Children's. What brought you to nursing and why pediatrics?
I really have had a lifelong interest in thinking about how to support kids going through difficult circumstances and major healthcare disruptions. I had an experience as a young child when I was 5 and had major surgery. And I think that informed a lot of my perspectives because while it traumatized my parents, my mother in particular, my nurse mother, I wasn't traumatized by it. And I think it was because my mom just inserted herself, family presence, and stayed with me throughout. And I began to really think about the fact that I thought healthcare should actually be designed in ways that allowed family presence no matter the age. I still believe pediatrics could teach adult healthcare quite a bit.
I've read quite a bit about your Cameo work, and I think it's based on this concept of the cognitive workload that pediatric nurses have. You spent quite a bit of time quantifying that workload and then using this tool to make some important optimizations. So can you walk us through what it is and what inspired its development and how it's changed the way you at Boston Children's are approaching staffing and care delivery?
I think it's a terrific example of nurse-led innovation, obviously co-created with physician colleagues, data scientists, and others within Boston Children's, but really nurse-led by both our operational leaders. And I'll just say there have been 2 or 3 people in particular, Dr. Patty Hickey, who is the nurse leader in our critical care and cardiovascular and peri-op areas, and Dr. Jane Kahn. Really going back about 15 years, they came up with the idea that and they really noted, and I think many in nursing and healthcare have noted that just capturing a bunch of tasks doesn't really reflect the work of care teams, and in this case, nurses, but rather there's a tremendous amount of cognitive work that requires nurses and care team members to really factor in what's required. It's not just measuring that it takes 2 minutes to give a certain medication or to do a certain procedure, but it's what's the cognitive care coordination that really supports safe, high quality care. And that's really been a dilemma. So, really going back to the 1970s, people tended to focus on task based ways to quantify workloads in all industries. And this was really a breakthrough to think about how the work of nursing does have tasks and very important tasks to do reliably and consistently, but nurses also are often at the hub of the whole care team, orchestrating what's going to happen in what order. And they have the primacy of being with the family in pediatrics all the time. So when families come and they have very compelling needs in terms of needs for information, need for education, support of the whole family system, nurses are orchestrating all of that. And unfortunately, in most cases, nursing staffing models don't account for that time. And so they have really struggled in nursing to accurately forecast staffing needs.
Typically, staffing is based purely on the number of patients, perhaps their acuity, the skill level of the nursing, but it doesn't necessarily incorporate the cognitive load, which goes beyond both the physical tasks, right? It's also intellectual, emotional.
It's really all of those components. It's really looking at dimensions. I'll just give maybe a case example would be a good way to look at this. If you think about a family in the cardiac ICU, they have all the physiologic complexity of many pumps and physiologic parameters that the nurse is managing and monitoring with the care team. But additionally, you may have a family at the bedside that speaks English as a second language. They may have other family members with them. Depending on what stage in their trajectory, they may be either transitioning to another level of care, possibly being discharged from our critical care unit to another setting, possibly even to home. And the tool is really meant to help anticipate staffing needs so that you can think of this as something the nurse leader on the unit, the director of the unit, needs to be able to plan staffing 24 by 7. That charge nurse on off shifts and weekends needs to be able to adjust the plan that was first put in place. And over time, you would really want to see how accurately were these needs anticipated. And so being able to use data analytics to see how closely were these estimates to what was actually required, and to really help with budgets and to accurately identify what's needed. The tool is at Boston Children's now increasingly being automated within the Epic Corporation electronic healthcare record. We have a library, a catalog of these dimensions of care, and that can be selected and applied once a day, twice a day, depending on the setting and the intensity. So, this is now helping us to look back and see how close we came to estimating the actual needs.
Nurse Jenny has been here through some very emotional periods. We know what is the right workload for her given what she's coming into.
So that's a great example where you could really look at the specifics of the healthcare team as well as the focus of the patient. And there are staffing and scheduling systems that do try to quantify. You have a brand new graduate, they have X skills or experience levels, et cetera. A lot of what you just described really is what gets translated at the level shift to shift by a charge nurse, really understanding that person's continuity of care. It may be beneficial for that person to have a similar assignment. The team that's scheduled on a given shift, it's based on the needs of the patient. We call this, there's a model called synergy, and it's really looking to match the needs of the patient, the needs of the caregiver together. But I think what this tool does, and Cameo stands for complexity assessment and monitoring to ensure optimal outcomes. So if you break that down, complexity assessment and monitoring. So first you're assessing, then you're trending this over time. And then ultimately, we're really looking to say, how close did we come to matching what was really needed? Did we end up being short staffed on this shift? Did we underestimate what was needed? Why did we underestimate it? Did we staff it excessively and staff it beyond what we needed to do? We need to be very accountable, both for cost reasons as well as for quality and safety reasons about how we staff. And I just think this is a fabulous example of a nurse led innovation that's changing the way we deliver care. And proud to share that Boston Children's is now helping to scale this up in other pediatric hospitals. It's becoming both a national and international tool, with about 10 organizations also using the tool within the United States and a couple outside the US.
So you've been doing some innovative work around newborn care models, and one was around your newborn circumcision clinic. This has achieved national recognition through the Edge Runner Award. So tell us more about this.
It's a great example of a nurse practitioner led innovation. One of our Vivian Williams, who's soon to be Dr. Williams, who's just soon to complete her DMP, has worked a lot with our urology patients over the years. And we have a lot of children who come here as newborns and need to have surgical procedures or who have high intensive care for a long period of time. Parents make their own choices about circumcising their children. And so it's our view that we want to support the best experience that we can for that child and for the family. And so many times circumcision is delayed post the immediate newborn period of time. And there's an ask of where there's many examples nationally where kids were actually coming back having procedures in order to be circumcised. And really, Vivian saw that and really saw recognition that this is not something that should require that kind of cost burden for the family, for health system, that indeed people can do this skillfully with practice, do it effectively so that there's no sequela after the procedure. And also that you can do it with attention to pain management, privacy, in a circumstance that the family would wish for the procedure to be performed. So the Edge Runner Award from the American Academy of Nursing was created to really showcase nurse-led innovations that reduce cost, improve care quality, and also tend to coalesce around certain variables having to do with the areas of focus that nurses have around caring practices, safe, high quality care, et cetera. So they identify a few folks nationally, usually 5 to 10 a year. Vivian was recognized for this initiative about 5 years ago for this innovation. The results have been families are saying, my goodness, you made this more convenient. This was a modest expense for us, much more convenient. Our child recovered quickly, didn't go through anything traumatic in terms of pain and difficulty. And why not have a nurse practitioner do this as just something affiliated with their care with a department that already knows their other medical conditions?
Laura, thank you. You've given us some great examples of how you and your nurses are leading the way as it relates to innovation, and there are nurse-led innovations happening all across this country, and I think we're all better for it. So thank you and appreciate your time.
It's a pleasure, and thank you for the opportunity to carry this message forward around nursing and innovation and optimism.
All right. Thank you for joining us for your dose of optimism. Make sure to check out our show notes to get more information about our guests and the work they're doing. Visit our podcast page on the KidsX website to join our podcast community and to learn more about pediatric innovation. Thank you to our sponsors and to our presenting partner, KidsX. Please subscribe wherever you get your podcasts, and remember, it takes a village to make sure our kids grow into healthy adults. So volunteer at your local library, help out at the community center, and thank your crossing guard. And if you're so inspired, donate to your local children's hospital. All right, see you next time. The content, views, opinions, and information presented on this podcast do not reflect the views of Children's Hospital Los Angeles or of the sponsors of the podcast. CHLA does not endorse the views, opinions, and information presented on this podcast, and CHLA specifically disclaims any legal liability or responsibility for the podcast content.